So we do bone grafting for a lot of our patients because with periodontal disease, the disease process causes bone loss. And the bone's what's holding your teeth in place. So the really neat thing is we can add bone back to the jaw and it adheres to the jaw and that stabilizes that. So we're able to regrow bone.
So the tooth becomes loose because the bone maybe is going away a little bit?
Yes.
And you're kind of adding bone?
Right.
And that's why they get stronger?
Yeah. I tell patients, I say, imagine you had like a pot, it's like a pothole in the road, and we're going to fill that back up. Well, that's going to make that stronger and more stable because we're able to regrow that. And it's a very non-invasive procedure. In most cases, we can just gently push the gum tissue back. We place that bone in there after the infection and everything is cleaned out. We just place that up, we close the gum tissue back, and that's it. It's as simple as that. We're able to regrow bone. We've been doing this for over 20 years.
And so what are the frequently asked questions patients want to know when they're being told, okay, you need bone grafting?
Right. So they want to know, where does the bone come from? So that's always a good question. So there's two different ways to do bone grafting, or three really. We can use their own bone, which we almost never do because then that's another painful procedure that has to be done. Their bone banks, and that's typically what most periodontists do, and we do that. We acquire sterile bone, and it acts as a filler. Thirdly, we use synthetic bone. Sometimes we're just trying to fill that space up, and that's what the synthetic bone does. So the neat thing is we have many different ways to achieve a great result. The idea is replace the bone, make the tooth more stable. This is done with implants too.
Now, have bone building, grafting techniques changed over the years? I mean, how much better is it now than it was just 5 years ago or 10 years ago? As far as discomfort, downtime, and all that.
Well, I would say the technology has changed where in certain cases we can place growth factors in there. So proteins. I know it's kind of technical, but basically we can take growth factors or proteins injected into the bone and we get a much better result. Okay. So we can take their own blood, spin the blood out, and it's called platelet-rich plasma, just another fancy name for a procedure which helps bone grow. It doesn't make it any better than in the old days when we didn't do that. It heals faster. So that's the beauty of things. Like with implants, the time to get things finished is so much shorter. The healing is so much faster with the newer techniques that we're able to do.